My name is Puneet Gupta. I am a cosmetic physician in London and I mainly specialize in cosmetic dermatology and body sculpting procedures, including liposuction and fat transfer to breasts and buttocks. All the procedures are carried out under local anesthetic, and I've done more than 2000 procedures till date. The purpose of this video and talk is to simplify the whole process of liposuction and create a better understanding. Liposuction is a very simple science, and it's a piece of art. It's a lot more than a surgical procedure. And what is important to understand is that the liposuction needs to be safe and effective and less invasive. And this is where the differences are. Traditional liposuction under general anesthesia used to be a lot more aggressive. It involved a lot more blood loss, hospital stays, using cannulas which are quite thick, almost as thick as a finger. And although using bigger, thicker cannulas are easier for the surgeon for removing fat quickly, it is never good for the aesthetic result because you are more likely to create unevenness and rippling effect after the procedure. Microlipo, which is used by microcannulas, where it use tiny metal tubings about 1 millimeter in diameter, which are used through 1 millimeter adits or holes in the skin, which means those holes heal with virtually no scarring. There is very little downtime. Most patients can return to work within 2 to 3 days time. You wear surgical compression garments for 2 to 3 days, and the overall aesthetic result is a lot more pleasing and natural because of the use of finer instruments. Dr. Jeffrey Klein from California invented this revolutionary method of anesthetic called tumescent anesthesia, which involves using diluted amounts of anesthetic fluid in the localized area and filling it up to the point where it becomes hard and swollen, hence the name tumescence. And then you leave that tumescence to work for about half an hour to an hour for it to be absorbed by the fat cells, which means everything is loose, everything is anesthetized. It shuts down the capillaries in the area, so minimizes surgical blood loss. And then the area is ready to be removed, the fat to be removed. The whole modification of adding an energy assisted method at this stage of either using laser or ultrasound of any types only brings in that increased trauma to the skin and longer recovery period. Hence, most patients who would go through these procedures will find the recovery was a lot longer, return to activities was a lot longer. They may need to go through some additional forms of treatment in the first 4 to 6 weeks, like different types of massages. They may also need to be left with some surgical drains post procedure, which you do not need with microlipo. They may need to wear the compression garments for 4 to 6 weeks, which most people finds the most uncomfortable part of the treatment. The answer to that is always you cannot tell that. You need to take out whatever needs to come out, and you cannot go into the area with a predefined number in your mind. I say to everyone, the whole art of liposuction is not how much to remove, but how much to leave behind, so the area look aesthetically pleasing, as if nothing is being done and not depleted unnaturally. What microlipo can remove, no other method can remove, purely because you keep on going till most of the fat has come out of the area, as long as your patient is comfortable and anesthetized, which is often the case. There are none as such with microlipo because most of the things are taken care of. However, I do see a lot of patients treated with energy assisted methods, and they regularly present with diffuse redness or a bruised pattern in the area called erythema ab lipo. I do see regularly a lot of patients having lumps and bumps or seromas, which are again a big side effect of any energy assisted method, causing excess damage to the skin. My advice to everyone is not to get carried away by advertisements and reading materials and websites and forums. They are a good source of information. They tell you what to ask in your consultation, but you should come and see a doctor and then get your answers. If you are interested in seeing me for more information for your suitability and what can be done, then please feel free to give us a call or log on to our website, and we'll be happy to help.